Absolutely. We're the newest assembly. Our assembly is dedicated or committed to enhancing research, state-of-the-art clinical care, and developing policies that will improve the lives of patients with lung cancer and all other thoracic malignancies. Lung cancer is the leading cause of cancer death in the United States and in many parts of the world, in both men and women. So we are extremely dedicated to moving the field forward across research, basic science, clinical research, to improve the care of our patients. And that also includes promoting tobacco treatment and tobacco prevention. Oh gosh, there have been so many. It's been an absolutely amazing past few years. Perhaps the most important has been the development of immunotherapy drugs to target advanced lung cancer, particularly non-small cell lung cancer, and it has been revolutionary. And it came on the heels of all the work that had been done with targeted therapies for certain cancers, but now expanding the treatment paradigm in patients with these immunotherapies, and it's been revolutionary. And every year, I mean, since 2015, there have been major breakthroughs in multiple drugs that have been approved rapidly by the FDA. On the heels of that, of course, comes toxicity, and particularly in the lungs. So we, in our society, in our assembly, in the American Thoracic Society, are really involved in understanding the immunotherapy-induced or checkpoint inhibitor-induced pneumonitis, trying to understand the biology and how best to evaluate patients who might be at risk. We held a workshop a few days ago with a multidisciplinary group of individuals, radiologists, immunologists, medical oncologists, to try to come together as a team and a group and try to better understand this phenomenon. So that's one area. Lung cancer screening has been a really exciting component of lung cancer care since 2011. We have been very involved as a society in better defining implementation and strategies that are necessary to carry out responsible and state-of-the-art lung cancer screening, and to better understand what populations should be screened, should not be screened, perhaps because their risk of dying from other diseases is very high. And more recently, again, getting back to the molecular biology, is the role of molecular biomarkers in patients who are undergoing screening and who are found to have screen-detected nodules. And perhaps even down the road, the role of these biomarkers in helping us select patients who would be best suited for lung cancer screening. So that's been, a very exciting, it's been a very exciting time for us, for those of us who have cared for lung cancer patients for many years, because the advances have been really significant. Oh, we've had several. We had a terrific lung cancer postgraduate course. That was an all-day course that covered the entire spectrum of lung cancer, from screening to palliative care. We have multiple symposia that address patient selection for screening, the role of biomarkers in lung cancer screening, the patients with comorbidities and whether or not they should undergo screening, the biology of, in the immunology of lung cancer, pneumonitis and complications from therapies, management of nodules. There's been so much here for any patients, for anyone who's interested in lung cancer. And it's not just in postgraduate courses, because in addition to lung cancer, we also have an interventional pulmonary working group that's very closely linked with the Thoracic Oncology Assembly. We have many symposia, we have Meet the Professors, we have many abstracts that are being presented. So it's really been, again, a very exciting time for lung cancer pulmonologists.